Lotta from Roots Community Health reporting for the week of June 16th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. Today, I'm joined by co-host Monique Campbell, Clinical Programs Manager at Roots, who will share some key information in honor of Alzheimer's and Brain Awareness Month. Let's get started with our infectious disease update. First, taking a look at respiratory viruses among patients presenting to a healthcare setting for testing. As of June 7th, the largest share of cases by far is made up of rhinovirus enterovirus, which is depicted there in the gray line. And then that is followed by parainfluenza virus in the yellow, which is shares ticking up just a little bit. Human metapneumovirus in the black, and then SARS-CoV-2 is in the red, coming in at number 4. Its share is also increasing just a little bit. So this has kind of been the case for a few weeks now, so no big changes here just yet. When we take a look at SARS-CoV-2 in the wastewater, we can see that each region is either very low or low. The ones that are a little bit higher are low and increasing, and that is the west in the teal there and the south in the purple. So we will just keep an eye on that. When we take a look at the map of COVID epidemic trends, and this uses modeling based on emergency department visits to see what direction things are heading, we can see that pretty much the whole country is either unchanged in the gray or likely declining or declining in those shades of green. The white means that we don't have enough data for whatever reason. So the only place where it appears to be likely growing at this time is in the state of California, depicted in the lighter purple. So something to keep an eye on. And when we take a look at COVID deaths, there have been 208 COVID deaths recorded so far for the week ending May 17th. So this is 3 weeks in a row with record lows for the entire pandemic. And we can see that even more clearly when we take a look at COVID deaths for all time. So when we look back at the week ending January 9th, 2021, we had nearly 26,000 deaths in the United States in just that 1 week. In fact, we were losing over 20,000 people per week for pretty much all of December 2020 and January 2021. And then, of course, vaccines became available, things began to improve, and we still had many waves after that. But more or less each year, deaths from acute COVID have been decreasing, but they still are higher than flu and RSV put together when we look over an entire year. So we still have a lot of work to do there. We still have a lot of work to do on all of the above. Taking a look now at variant proportions, we can see those top 2 bars are the estimates based upon actual specimens that have been sequenced. And then the next 2 bars on the bottom are projections. And we can see that the purple just keeps growing as we go down, and that is NB.1.8.1. which I went over a couple of weeks ago, and NB.1.8.1 certainly appears to be overtaking LP.8.1 as the dominant strain. And so, as we talked about a couple of weeks ago, there doesn't seem to be any major cause for alarm at this point, but I did want to share what is coming out of European CDC. So the European CDC has put out an epidemiological update on this variant, NB.1.8.1, and it's kind of a good news, bad news thing. So they do point out having some slow increases of SARS-CoV-2 in several countries in Europe. And we have seen, for whatever reason, in pretty much all of our prior waves, we seem to see increases in Europe before we see them here. But they are saying that they're not expecting this variant to pose an increased risk compared to other variants, at least based on the mutations that it has and some of the early lab findings. I did review some of those a couple of weeks ago in case you're interested. But they don't anticipate that it will get around our vaccine effectiveness or protection we might have from prior infection. So that's kind of the good news. But having said that, they are anticipating increases in hospitalizations in the coming weeks. because of something we talked about last week, which is that we had relatively low circulation of SARS-CoV-2 over the winter, and this is going to leave more folks vulnerable to infection and severe outcomes in the coming weeks. They were pretty explicit in saying that they thought that the decreasing population immunity, both because of lower infection rates in the winter, as well as low vaccination coverage, but basically that the low population immunity itself is sufficient to drive a summer wave in Europe, even without any changes to the variant proportions. They're projecting a peak of hospitalizations similar to what they saw last summer. So I would really hate to see that here in the United States, because that would mean that we'd be looking at big increases from where we are right now. And we know that when there are increases in hospitalizations, there are also increases in deaths. And last summer, we got up to a point of over 1,000 deaths every single week. So we don't want to get back there when we're at a very good point now. So this European CDC report is very clear. It's very direct. I appreciate that. If you want to take a look at it, it is linked in the post. But in the meantime, it does look like this variant is still susceptible to Paxlovid, as well as the immune response we get to the current COVID-19 vaccine. So we'll keep an eye out once it starts to really circulate in the real world and we can get more real world data. This is all kind of laboratory data so far. As a reminder, the FDA's advisory committee has recommended that for the 2025-26 season that we stick with the same vaccine formulation from last year. So that means that the one that's available now is the one that's going to be available. And remember that if you are 65 and up or you have immune compromise, it is recommended that you get the vaccine every 6 months. And so we're going to essentially be thinking about that timing to protect for both winter and summer waves, which seems to be the pattern that we are settling into. And now for an update on the U.S. measles situation. As of June 12th, there are 1,197 confirmed measles cases, so more than quadruple what we had the entire year of 2024, when we had 285 cases, and we're still only halfway through this year and already quadruple. Thus far, 144 individuals have been hospitalized, and there have been 3 deaths. 2 of those were otherwise healthy children. And 90% of cases so far this year are outbreak associated. And by comparison, in 2024, only 69% were outbreak associated. So this in and of itself is concerning, knowing that these are not just imported cases from somewhere else. These are outbreaks where it is transmitting locally, which is what can happen in under-vaccinated communities. And so the situation has unfortunately necessitated the CDC to urge those operating camps this summer to check for documentation of measles immunity through vaccination or prior infection for all of the children and the staff and the volunteers of summer camp. So it's sad that we are at this point. However, given that this is the deadliest measles outbreak we've had in decades, and the fact that it does not appear to be getting under control, I'm at least glad to see that a warning is coming out. So I've linked a 2-page flyer from the CDC, which goes over how to prepare for measles before summer camp opens. This includes documenting measles immunity status for everyone involved. They even provide sample documentation templates. They also advise that you have a supply of filtration masks or respirators that you can give to a person with measles symptoms. And they also suggest identifying an isolation space where a camper with measles symptoms or staff with measles symptoms can be separated from everyone else until they can get picked up and receive medical attention. And then they go over a checklist of what to do if someone comes up with symptoms of measles, and that includes giving them the mask, isolating them, and contacting the health department and seeking care. And then they also have some good steps to consider about quickly making a list of anyone who might have been exposed, informing caregivers, and watching for measles in other folks in the days to follow. And of course, awaiting the guidance from the public health department. And they have a couple of additional considerations for overnight camps. So if this is of interest, please do check it out. And if you're a parent sending your kids to camp, don't be surprised if you're asked to produce proof of vaccination. Even though this might be a little bit of an annoying extra step that we're not used to, it is a worthwhile one since in many places we unfortunately can no longer rely on population immunity since it's dipping below the threshold we need to get that protection. So it will be interesting to see how widely this is actually implemented, but I did take it as a positive sign that the CDC is issuing guidance and stepping up its warnings about measles in general. And of course, if you're operating a summer camp, then it's a decision you have to make about whether you will allow unvaccinated campers or staff. And if you're a parent, you may also want to consider whether you feel comfortable with your child going to a camp where this is not being checked, given the current situation, especially if you are in an area with lower vaccination rates overall. So if your child has had the 2-dose series that is highly effective, we would consider them protected. So it's really the little ones who haven't received the full 2-dose series yet. This is usually not complete until 4 to 6 years old. When the second dose is given, you may want to do it closer to 4 than 6, especially if you're considering sending them off to any kind of camps, daycares, and so forth. And as well as, of course, those who are unvaccinated are susceptible. And unfortunately, also a small percentage of those who are fully vaccinated who may, for whatever reason, not have mounted a full response. And then, of course, there are some who cannot get the measles vaccine because of their underlying conditions. So it's easy to see why this is an area of concern for us all. And I'm glad to see that the CDC is giving out guidance accordingly. Now, a quick update on an RSV vaccine. The FDA recently expanded approval for Moderna's RSV vaccine, Immunovia, which was previously only approved for adults age 60 and up. As of last week, FDA expanded the approval to include adults 18 to 59 who are increased risk of RSV-related lower respiratory tract disease due to underlying conditions. So just a couple of things I wanted to note here. One is that Immunization is an mRNA-based vaccine, so this offers another option in terms of RSV vaccination. But I think it also highlights the fact that mRNA technology is useful and we are still applying it as we should be. Moderna plans to make Immunization available for both younger adults and older adults for the 2025-26 respiratory virus season. But remember, it's the Advisory Committee on Immunization Practices, ACIP, of the CDC that shapes the actual recommendations for the use of FDA-approved vaccines. So we believe that the ACIP will be holding a meeting at the end of June to vote on recommendations for RSV in younger adults, among other things. But as we know, the ACIP has been undergoing some turmoil, which I will speak on in just a moment. But first, I'm going to pass it off to Monique Campbell to provide important information about brain health.
Good morning, everyone. My name is Monique Campbell, and I'm honored to speak with you today on behalf of our Clinical Programs Department. As a trusted health resource serving our communities in East Oakland and beyond, we know that true wellness means caring for every part of our bodies, and that includes our brains. Today, I'm here to talk about brain health, neurological conditions, and why it is so important for Black people to be proactive in protecting their brain and nervous system health. This is a conversation that is long overdue and deeply necessary. Your brain is the command center of your entire body. It affects how you think, how you move, how you feel, how you remember, and how you experience the world. A healthy brain supports your mood, your relationships, your independence, and your longevity. While the brain is compromised, whether by stroke, dementia, epilepsy, TBI, or traumatic brain injury, or chronic stress, it can have life-altering consequences. Many of these conditions can be prevented, delayed, or managed when we seek care early and often. Let's be real. Black people are disproportionately affected by brain health-related issues. Black adults are twice as likely to develop Alzheimer's and other dementias than white adults. We have the higher rates of stroke, and when stroke does occur, it is often more severe and happens earlier in life. Chronic conditions like high blood pressure and diabetes, which are common in our communities, increase the risk of cognitive decline and other neurological complications. But let's not forget the impact of chronic stress, racism, and intergenerational trauma on our mental and neurological health. What makes this even more troubling is that Black communities are less likely to be diagnosed early, less likely to receive appropriate treatment, and more likely to be dismissed by healthcare systems. That is entirely unacceptable, but further defines why Roots is here. Here at Roots, we believe that our health is our birthright, and that includes our brain health. We offer a range of services to support neurological wellness, early detection, and long-term brain health, including primary care screenings that monitor blood pressure, cholesterol, and glucose, factors that impact brain health, mental and behavioral health counseling, because your emotional well-being is also a part of your brain health. And here in my department, clinical programs, we provide health education. By partnering with experts across the disciplines, we create and provide workshops that empower our community with knowledge about conditions like dementia, stroke, depression, and more. Referral partnerships with neurology specialists, imaging services, and case management for more complex conditions. Culturally competent care teams that not only understand your lived experience, but also listen to your concerns. Because we know care must be rooted in trust. So here's what you can do right now. Get regular checkups. Even if you feel fine, annual wellness visits can catch risks early. Control chronic conditions. Keep your blood pressure, blood sugar, and keep your cholesterol in check. Prioritize mental wellness. Therapy, mindfulness, and rest are all powerful tools to embrace. Learn your family history. If neurological conditions run in your family, tell your doctor. It is important and it can be vital to your care. So before I leave you, please know, Black health is Black wealth, and brain health is a critical part of that picture. Here at Roots Community Health, we're not just treating symptoms, we are building a healthier, longer living, and more empowered Black community. We're here to walk with you, support you, and ensure that your brain health is prioritized with the dignity and excellence you deserve. Finally, if you or your loved one is ready to take the next step in your health journey, reach out to us today. Let's protect your mind, your future, and our community. Together. Thank you. Back to you, Dr. Noha.
Thank you, Monique, for providing that vital information about brain health, about health disparities, and health information that is relevant to us all. And as we see some of our institutions weakened and our trusted sources being undermined, Roots remain steadfast in providing direct and clear information to you as always. And so along those lines, I wanted to end with an update regarding the CDC's Advisory Committee on Immunization Practices, which has been a critical source of expertise and guidance for decades, but is now under threat. Last week, I talked about the ACIP and how all 17 members were abruptly fired from their roles by RFK Jr. And if you're interested in some of those details, you can take a look at last week's briefing. But the bottom line is that there were a lot of words about how committee members have conflicts and about how the HHS secretary, is going to rebuild trust. But there was no evidence of any of his concerns provided, nor any information that would indicate that his plan would offer any sort of an improvement, and in fact leaves a lot of room for concerns. Since then, RFK Jr. apparently appointed 8 new members, several of whom have significant histories of profiting off of vaccine disinformation and selling alternative or wellness products instead. So it is unclear to me how those activities would not be seen as a conflict when you are making decisions on vaccination. And it is also not clear what the process will be to address these conflicts. I think just as great of a concern is the fact that the new committee does not possess the range or depth of expertise that the recently unseated 17-member panel did. On June 16th, The recently ousted ACIP committee members published this viewpoint in JAMA Network. I've linked it in the post. It's short. I highly suggest that if this is something you're interested in, you read it because it is very well done and succinct, and it does a good job laying out what is being lost and what is at stake. So I'll just provide a couple of the highlights. After laying out the importance of vaccines and monoclonal antibodies under the ACIP's purview as far as guiding their use, they talk a little bit about the history of the ACIP and how it has been regarded. The ACIP has served as a panel of experts for over 60 years, and they really set the national standard for how we use FDA-approved vaccines. So the FDA approves them, but the ACIP then creates the guidelines. They set the immunization schedules that are followed by pediatricians and family physicians and any clinicians that are offering vaccination. They are viewed as the definitive authority for us in the United States, and really also set the standard for the world. They also set the benchmarks that insurance companies follow, and in that way, the ACIP protects Americans' access to life-saving vaccinations. The authors, the 17 former members, also described a very rigorous process by which ACIP members are selected. So they have to have expertise in all these different fields across the 17 members. So each one will have expertise in one of these areas: immunology, epidemiology, pediatrics, obstetrics, internal medicine, family medicine, geriatrics, infectious diseases, and public health. They also actually work in these fields, in hospitals and clinics and health departments and academic institutions where they have dedicated their lives to actually taking care of patients and conducting research and being part of efforts to prevent the spread of infectious disease. We are not seeing this level of expertise or engagement in the newly seated panel. They go on to address some of the statements that have been made in the press against the ACIP, and they provide backup to refute those statements. Again, take a look at the article if you're interested. It also described the actual application process and review process to even get on the ACIP in the first place, which is very extensive. It can take up to 2 years for nominees to be approved to join the ACIP. So I'm not sure how long the new members have been vetted, but they certainly do not cover all these areas of expertise. And it certainly was not the 2-year process, obviously, for them to be approved to join. And there was also no handoff or overlap, which is typically the process to ensure continuity. The authors also discuss the time and effort that has to go into the work that they do, which is really evident. If you've ever watched any of these 2-day-long ACIP meetings, you can see it's not just the meetings. They put a lot of work in reviewing mounds of evidence. They chair work groups with CDC public officials on them. They walk through the frameworks of the evidence to recommendations that they use in order to make decisions. And all of this is done actually quite transparently. And that includes statements about any potential conflicts of interest. This is required at every single meeting. It is posted on the CDC website for the public to view. And as federal committees go, this is actually quite stringent and quite transparent. They also talk about the serious concerns they have regarding the recent changes to the COVID vaccine policy, which I covered 2 weeks ago in some detail. This was a change made directly by RFK Jr. and put out on social media, apparently completely bypassing any review process whatsoever. And this is highly disturbing. There's no evidence to back up these recommendations, no science, and yet it happened. And they close out their article expressing their deep concerns about these decisions, which are destabilizing and lack any clear rationale. And I and many of us certainly share this concern. I think many of us do, that we are going backwards, that we will now impact and impede people's access to vaccines, and this will put us all at risk. They even spoke to the attention the government is paying right now to so-called government efficiency. And they quantify actually how much illness and hospitalization and death they have prevented with vaccination. as well as a net savings of $540 billion in direct costs and $2.7 trillion in societal costs. And they refer to an MMWR report from last year in order to lay out these data. And I've also linked that article in the post. So I'm glad to see that the 17 members worked together on this piece. I actually wonder if they'll continue to work together to provide any ongoing guidance, because I can tell you that the situation is very troubling for those of us responsible for implementing the guidelines. You talk about restoring trust, and this move is doing quite a lot to undermine that trust, because now physicians are not certain that decisions have been made with the proper expertise at the table or taking into account the proper data or science, because there's just no evidence that that's going to be how decisions are made here. So I think this is very worrisome. And as much as I will be keeping an eye on what the newly constituted ACIP does, I'll also be keeping an eye on what these experts and other experts are saying, and obviously what the data is telling us. And just like with RFK's new guidelines, he seemed to just unilaterally put forward on the COVID vaccine, the science has not changed. The data has not changed. And he did not provide any science or data to substantiate his new recommendations. So this leaves us in a very suboptimal position as providers and those who have looked to these guidelines. Now, if you have a primary care provider who's tracking all of this and paying attention to the science, then you are fortunate, and you can certainly and should certainly have these conversations with your doctor to advocate for what it is that you need. Because remember, the majority of these vaccines that we need are fully licensed, they're fully authorized by the FDA. So what that means is that even if RFK Jr. or the new ACIP were to change guidelines, your provider still has discretion. In that case, it would be considered off-label use, but there's nothing prohibiting them from doing that. Now, the problem is, as I've stated, insurance may not want to cover what your doctor recommends, or they may have to go through a lot of paperwork like prior authorizations and things like that. So there's no question in my mind that access will be limited as a result of these moves. And as we know, as we've discussed, when it comes to many of our successes in vaccination, is based on a certain threshold of the population actually being vaccinated. So the fact that we're restricting access is troubling. Even if you yourself have access, even if your child has access, what about your children's classmates? What about your coworkers? What about others who are riding public transportation with you? So we are all in this society together, and moving in this direction, it will hurt us all. So for those of us in healthcare, our jobs have just gotten a whole lot more difficult, because it may be that we are trying to balance what we know the evidence tells us with what the new regime is putting forward, which leads to kind of a two-tier reality. But I think it's safe to say that for those in power, those making these decisions, their access will not be limited. They will continue to have access to the best science and the best care. I hope they'll share with us what that really is. Yet their decisions will have a profound impact on the entire population. So hard to say what's next. It feels like every day there's some new unwelcome news about the direction that we're heading in health and public health. But we will continue to stay focused. We will continue to stay evidence-based. We'll continue to try to track all of these developments. I think now more than ever, it is critical that if you do not have a primary care provider, you get one. This relationship is going to be paramount as our public health infrastructure continues to be eroded and compromised. It means that your individual health, the way you are interfacing with the healthcare delivery system, will become that much more critical. And having an advocate who is your primary care provider becomes that much more critical. So we will keep fighting for public health. We will keep fighting for community health and advocating for access. But in the meantime, please make sure that you and your family and your loved ones have a primary care provider you can trust, who's willing to follow the science and stay steady and focused through all of this turbulence. And the same goes for all of us. Try to stay steady and focused during all of these turbulent times. Try to be good to yourself, be good to your body, eat a balanced diet, stay well hydrated, quit smoking, avoid alcohol and simple sugars. If you don't feel well, make sure you get your rest. Otherwise, get some regular physical activity, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you next Tuesday at 10 a.m.